Good day, sir.
Good day. Thank you for having me.
Can you briefly introduce yourself and what a somnologist does?
Okay. My name is Olatunji Olaoye, originally from Nigeria. Currently practice in the US. So basically, am an internal medicine board certified as well as fellowship trained sleep medicine specialist. And to your question of what a somnologist does, a somnologist is a sleep medicine specialist that essentially deals with all aspects of sleep disorders.
What inspired you to specialize in sleep medicine?
I like to sleep actually, and one of the early triggers was a colleague of mine who had high blood pressure, and when he went to see his physician, part of the questioning was about snoring, and which he said yes to. And from there, he was diagnosed with sleep apnea, treated, and from using two medications to treat his blood pressure, he completely went off medications, which was very intriguing because by fixing his sleep, he was not only able to sleep better and feel better in himself, he actually got rid of a medical comorbidity.
What are some of the most common sleep disorders you encounter?
There's a whole range of sleep disorders, those that happen when you sleep and those that prevent you from sleeping. By far, the commonest is what we call obstructive sleep apnea. This happens when you stop breathing multiple times during the night when you're sleeping. This then triggers a host of reactions in your body that leads to cardiometabolic complications. That is, it may be the beginning of poorly controlled hypertension, poorly controlled diabetes.
What are the early signs that someone might be dealing with a sleep disorder?
So the one of the earliest signs is when you have had a night's sleep and you wake up feeling not refreshed, feeling tired and wanting to still go back to sleep. It also affects you throughout the day where you just feel sleepy and you actually fall asleep in inappropriate situations. Other people may also notice something wrong. For example, there is an overnight sleep at somebody's house, or a partner tells you that they couldn't sleep because you were snoring so loudly. That most of those is due to sleep apnea. With regards to insomnia, it's pretty obvious. You just cannot fall asleep for several hours despite sitting on the bed and despite trying to go to bed. There are other spectrum of sleep disorders, but anything that disrupts your sleep mostly would manifest the following day because you then feel not rested.
Can poor sleep really affect your physical and mental health, and how?
Yes, several studies have shown the association between poor sleep and medical conditions such as hypertension and diabetes. Sleep apnea on its own causes poor sleep because it causes multiple awakenings at night, meaning that you don't get the quality that you need. Sleep essentially has two components: quantity, how long, and quality, how well. When any of them is affected, it has ramifications. For example, somebody with sleep apnea that wakes up multiple times during the night has elevated levels of certain hormones that then pushes their blood pressure up. If they were already on being treated for blood pressure, it tends to be resistant to treatment with the medications that they're having until that sleep apnea is treated. Mental health wise, same thing is you don't if you have a very poor sleep at night, you tend to get tired during the day. You cannot participate in certain activities that you may otherwise enjoy. You cannot go out with friends simply because you just don't feel awake enough. So that in itself can affect the mental health. And there's several studies have also shown the relationship between poor sleep and depression with anxiety.
How many hours of sleep should an average adult get? And what are your opinions on naps?
So the studies have shown that 7 to 9 hours a night is the recommended sleep for an average adult. And that is what typically we recommend that you get at least 7 hours of sleep a night, which plays into rejuvenation the next day. But again, the number of hours is how long you sleep. The quality of the sleep also is important. But to your question, yes, 7 to 9 hours. Naps are usually a way of short sleep. Now, we recommend that even if you're going to take naps, it shouldn't be more than 20 to 30 minutes, simply because taking very long naps can actually then affect your sleep at night, which may have follow on effects the following day. So, naps are okay, but they have to be done in small quantities.
Okay. So what's the difference between insomnia and just having trouble sleeping for a few nights?
So both of them are insomnia. Insomnia simply means that inability to fall and stay asleep. Now, whether that goes on for 3 years or goes on for 3 days, um, uh, depends on the circumstances. Sometimes not being able to fall asleep for a few nights may actually be the trigger for long-term insomnia. Some people have what we call situational insomnia, where the environment itself may be the trigger for the insomnia. So, for example, they went for a conference in another town and had to stay in a hotel for 3 days. They may not be able to fall asleep easily, or they may wake up very frequently. However, the moment they return home, they go back to their usual schedule.
Are sleep medications safe for long-term use?
We typically discourage them simply because you're treating a symptom. The recommendation would be to actually go ahead and figure out why you're having sleep issues rather than taking sleep medications. Yes, sleep medications have their role in treatment of sleep disorders, but we would prefer that you actually seek expert opinion prior to self-medicating on sleep medications.
What are the top three things people do during their sleep?
First and foremost, or number one, is still scrolling through social media with their phones when they should be sleeping. The other, the other part is that sleep has to be treated like an activity. You have to prepare for sleep, meaning you have to have specific bedtime, you have to have an enabling environment, and you have to avoid things that may hinder your sleep, such as screen time, like we talked about, scrolling through cell phones when you should be sleeping, heavy exercise before bed, smoking or drinking alcohol just before bed, to mention a few.
Can you give us the few services we offer here at ASFA for people with sleep issues?
So we offer consultation with a sleep specialist. We also offer sleep study. We can do sleep study, as well as we can also provide treatment for diagnosed sleep disorders.
When is it suitable for someone to come see a sleep specialist?
The moment you realize that you have a sleep problem,
Okay.
and you can also be referred by your general practitioner.
Any words of advice to people who think sleep is a waste of time?
Sleep is not a waste of time. You need to sleep to quote unquote recharge. And by not sleeping, you're actually exposing yourself to certain medical comorbidities that may have significant impact both on the quantity of your life as well as on the quality of your life. So I would say make sure you get enough sleep at night, minimum of 7 hours. And if you have any issues, either falling or staying asleep, or you wake up in the morning, you're not refreshed, you should see a sleep specialist, as that may be a warning that you have a sleep disorder that can be easily treated.
All right. Thank you so much for your time.
Thank you. It's my pleasure being here.